Hello, everybody. At the outset, I would like to extend my sincere thanks to the organizers of the 11th edition of ICDO for the gracious invitation to speak at this esteemed conference. It is an honor to present my work before such a distinguished gathering of academicians. I am Dr. Gulnar Sethna, an associate professor in the Department of Periodontology at Government Dental College and Hospital, Mumbai, which is the largest dental college of Asia. What is the image that you conjure when you think of artificial intelligence? We often picture cyber soldiers, cyborgs, or robot uprising. However, AI is more like the Matrix, a bunch of invisible algorithms working behind the scenes, making our job easier. Like a digital ninja, AI has steadily infiltrated our lives, starting with voice assistants that know our schedules better than we do, or self-driving Tesla cars, or unlocking your phone or your playlist with a smile. AI has also become a central theme in many sci-fi movies. And now there are new players in town like DeepSeek and Grok who are giving ChatGPT and Google a run for their money. So today, my topic, probing to programming, the AI revolution in periodontology, will give you a glimpse into how AI is shaping the future of periodontics and integrating it with AI one bite at a time. These are the contents of my presentation: introduction, how does AI work, role of AI in periodontics, AI assisted diagnosis and imaging of periodontal disease, the role of AI in risk assessment and in education and research, what are the challenges and ethical considerations, and conclusion. So, AI is a branch which helps to think, learn, and perform tasks that require human cognition. Today, we'll dive into AI, starting with Alan Turing, who is the father of modern computing. So he was a British mathematician who broke the German Enigma code during World War II. So he introduced the Turing test, which is also known as the imitation game, to see if machines could think like humans. It was in 1955 that John McCarthy, who was a young assistant professor of mathematics, he picked the name artificial intelligence for this new field. So can machines think like humans? For a quick throwback, let's start with Deep Blue, the AI by IBM that beat chess champion Garry Kasparov in 1997. It proved AI could beat humans at complex tasks. Today, we'll see how far AI has come since then. AI has revolutionized healthcare, and dentistry is no exception. We know that periodontal disease is a chronic inflammatory disease which is triggered by a dysbiotic microflora in the gingival sulcus, which in turn activates the host innate response. Now, diagnosis of periodontal disease is based on clinical judgment, where you have probing pocket depth and clinical attachment loss, and radiographically by IOPAs, OPGs, and CBCTs. Now, there are some inherent challenges in diagnosis, in accurate and comprehensive diagnosis of periodontal disease. So, the first challenge is the human error in interpretation of X-rays. So, when our human eye can detect subtle grayscale variations of only 1 to 2%, AI can detect subtle grayscale variation of 0.01 to 0.1% at a pixel intensity level. There's always a diagnostic dilemma for the inexperienced clinicians. Also, the newer 2017 classification by the World Workshop of Periodontology for periodontal disease, that also is more challenging and complex to understand. So we have voice-enabled periocharting. Periocharting is the cornerstone of periodontics. So by speech recognition and natural language processing, AI can interpret verbal inputs and it converts it into meaningful data like probing depth, bleeding on probing, mobility, furcation, etc. Imaging plays a very important role in a patient's dental voyage, from diagnosis to treatment planning to conducting and re-evaluating therapies. So, using deep learning algorithms, AI models are trained on vast data sets of dental radiographs, allowing them to recognize and calibrate subtle patterns. So, by using color coded overlays, you will be able to highlight specific areas of interest, like you could detect in like a blue restoration, a blue area shows a dental filling, an orange will show an incipient caries, and for this you need special software like YOLO or You Only Look Once. These are different softwares which can be used for detection of radiographs. Now, staging of disease, the newer classification of periodontitis is based on staging and grading. So, on the basis of labeling, annotation, and segmentation, you're able to find out the distance between the CJ and the alveolar bone crest. And this helps in periodontal risk assessment of alveolar bone, where you can correctly quantify the amount of bone loss that takes place, and on that basis you could classify it as stage 1 where there is less than 15% bone loss, stage 2 where there is 15 to 33% bone loss, stage 3 where there is more than 33% bone loss and around 20 teeth remaining, and stage 4 is when there is more than 33 bone loss and less than 20 teeth that are remaining. Now, the ultrasonographic probe, this uses sound waves to see inside the tissues, and with the help of AI, it can give you a more detailed, precise insight into periodontal health. You have the ultrasonography for the exploration of periodontal tissues, where it has a miniaturized high frequency transducer of around 20 hertz, which can be used for production of images of sufficient resolution. So, with the help of ultrasound, you can distinguish between healthy tissues and inflamed tissues. So, here, when you see a green arrow, here you see that there is no calculus that is present, whereas over here you would see that there's an excessive thickness which is suggestive of calculus. Now, also it shows the health of the periodontium. So the epithelial connective tissue, if you see green, it shows an arrow. This indicates a healthy connective tissue, whereas over here inflammation in the epithelial connective tissue border, here you would see a more diffuse hazy mass suggestive of inflammation. Oral halitosis contributes to the formation of volatile sulfur compounds which are produced by the bacteria in the mouth. But we also have what are known as volatile organic compounds, and using artificial neural network, head and neck squamous cell carcinoma and oral squamous cell carcinomas can be detected using AI. AI has also been used in the field of implantology, where it can be used to identify the type of implant that is there. And for this, you require different types of software. You have spot implant and what implant is that.com. So these use convoluted neural network to find out the type of implant that has been placed. AI is also used to generate digital workflow for a surgical guide. It uses multimodal imaging like CBCT, intraoral scanner, CAD/CAM technology, etc. So what typically happens is that you have your CBCT anatomical landmarks are identified and segmented. You register and fuse it with the images that are obtained by the intraoral scanner. You make a digital wax up and a surgical guide is made. Now, when we are using AI based automation in pre surgical digital workflow, after you have done the CBCT you have overlaid it on the intraoral scanner, it automatically they are uploaded to a cloud-based segmentation software like Relu, which is by the Belgian company, where the platform creates a virtual patient using AI algorithm, and this is transferred to a AI black box, which makes complex commutations not easily understood, and digital planning is then done. So this saves a lot of time. AI is also, it plays a very important role in periodontal education. So dental simulators are training tools that use technology including virtual reality and haptic feedback to provide realistic training for dental students and professionals. So there are two types: mannequin based and the haptic based. So in the mannequin based, it provides a basic physical model of the patient's head and mouth on which certain dental procedures can be performed using real dental instruments. Whereas in the haptic, you the technology, it simulates a sense of touch. So the advantage is that you're doing procedures in a virtual environment without any risk to the patients. We also have augmented reality, which uh, which uses technology to combine a simulated environment with the real environment, and this can help in placing dental implants by providing real-time visualization of the patient's anatomy. And for this, you rely on optics like the HoloLens to provide that simulated environment. What is the role of AI in periodontal research? So it plays a very important role in 3D printing, where it includes bioresorbable scaffolds for periodontal repair and regeneration, socket preservation, sinus augmentation procedures, and guided implant placement. We also have 3D bioprinting. So bioprinting is printing of living tissues by layer deposition of bioinks. These bioinks are what contain living cells and biomaterials. So this is the bioink, that is mesenchymal stem cells of the apical papilla, periodontal ligament cells. So this bioink is seeded into the biomaterial uh, ink scaffold, that is your natural polymers, synthetic polymers, and composite materials. And after the seeding of the bio ink into the biomaterial ink is done, these are cultured over there, and after that a 3D printing bioprinting process is done. So you need to use an MRI and CT scan, and bioinks are prepared, and these are then introduced into a printer cartridge, and based on the digital model of the cells, they are accumulated layer by layer. We also have nanorobots. This was a concept which was first conceived by American physicist Richard Feynman in a lecture where he said there's a lot of room at the bottom. So for the longest time, nanorobots have been used for killing cancer cells, and the same technology is now used for treatment of dentine hypersensitivity. So there's a Bangalore based startup which is known as Theronautilus. So this company, and they developed magnetically controlled nanorobots that can navigate through the dental tissues into the dentinal tubules, and they form calcium clots which are known as the calbots, and this is how they help in the treatment of dentine hypersensitivity. There are also smart toothbrushes which use sensors to track the coverage and pressure which is applied during brushing, just to ensure that each area of the mouth receives adequate attention. We also have toothpaste dispenser using AI. So there are smart dispensers that will include voice assistants like Alexa or Google Assistant, allowing you to ask for specific toothpaste brands also. AI plays a very important role in teledentistry. So there's a paradigm shift from curative to preventive personalized approach in periodontics. So here there are different platforms of teledentistry which help in screening. So in India, we have Scano Air, we have Muskan, And we have eDant Seva. This is a web-based interactive site and mobile app which is created by the Ministry of Health, the Government of India, and which aligns with the principles of National Oral Health Program. So it links all the dental schools and around 1,000 primary and community health centers across India, so you can easily track and map them. So all these platforms have to be HIPAA compliant, which means that they should be compliant with the Health Insurance Portability and Accountability Act guidelines to ensure that patients' information is end-to-end encrypted and secure. We have certain services outside India like Overjet, Vidya, Health, Dexis, Orac, etc. Robotic surgery. The dental robots which were made by Boston-based company Perceptive. This has been approved by the FDA and it uses the Da Vinci surgical system, which is the most advanced platform for minimally invasive surgery. So that was Yomi, which is the only FDA cleared robotic device for dental surgery. What are the advantages of artificial intelligence? So, firstly, it helps in maintenance of patient records, risk assessment, diagnosis of and monitoring of periodontal disease, early detection. It also offers advantages of accuracy, standardization, reduces human error, and saves time. Along with that, there's a flip side to AI too. As cutting edge technologies are developing at a staggering pace, so are cybersecurity threats. And here comes the responsibility, accountability, and liability. So you need to have data privacy and security. You need to have informed consent, and most importantly, we need to have training data and algorithm basis. You need high quality data. Cost is again an important factor. The other important factor that has to be understood is the human in the loop technology. This gives room for humans to oversight the function and performance of. So, to conclude, AI empowers periodontists, it improves diagnostics, radiographic interpretation, disease classification and staging, risk assessment, personalized treatment planning, outcome optimization. AI is a tool to empower dentists. So, the future of dentistry will be a partnership between human expertise and cutting edge technology. Will AI dominate
Mark my words.
over human
AI
intelligence?
is far more dangerous
AI is
than
far
nukes.
more dangerous
I think the
than
danger of
nukes.
AI is
I think
much greater
the danger
than
of AI is
the
much
danger of
greater
nuclear
than
warheads by a
the
lot.
danger of nuclear warheads by a lot.
So, will AI replace doctors? AI may be the future, but let's be real. It's humans who bring depth, meaning, and emotional richness to the world. AI won't replace doctors, but doctors who don't use it will be replaced. Thank you all for a patient listening.